Hi, Assalamualaikum. I'm Teacher Aishah. So today I'm going to present about the attention deficit hyperactivity disorder, which known as ADHD, and also learning disability. So what is ADHD? ADHD is known as a attention deficit hyperactivity disorder. Is a heterogeneous behavioral disorder of uncertain cause that always is evident in childhood, by that typically persists through adolescence and for some into adulthood. This is a few clinical features that have been present in ADHD. So firstly is the inattention, hyperactivity and impulsivity. So inattention, they will demonstrate by the failure to attend to details, difficulty sustaining attention during play. Also inability to listen actively to instructions or conversation, and also difficulty organizing tasks and evidence of tasks that require sustained attention. Alright, for hyperactivity, in hyperactivity, there will frequent fidgeting or irritability to sit when remaining seated in expected place, which is example in classroom, and also difficulty playing quietly and excessive talking and being constantly on the go. And for the impulsivity, there will be inability to wait one turns, frequent and incessant interruptions, and blurting out of answers before a question is asked. So there is some explanations for the first point, which is inattention, hyperactivity and impulsivity. For the second point, they will also present in easily to distracted and often forgetful in daily activity. Third one is low frustrated tolerance. Fourth one is sleep disorder, bossiness, excessive and frequent demands for attention, mood lability, demoralizations, dysphoria, peer reactions, and poor self-esteem. Okay, for the intervention, they have two types of intervention from ADHD. The first one is by medications, and second one was by therapies. So for the medication, they have two types. Ubat. The first one is amphetamines, and the second one is methylphenidate. Okay. They have some side effect from taking the medication. The first one was weight loss of appetite. The third one is interrupted sleep patterns and also the slow growth. But in the side effect, they have an advantage from taking the medication. The first one is to improve ataupun increase the overactivity, attention spans and impulsivity, and self-control, compliance, physicals and aggressions, social interaction with peers, and also can increase the academic productivity and accuracy. Also, there was functions in a mood setting, which is the medication will be control their punya activity daily living. Alright, other than that, they have a therapy. Okay, so one of the therapy that can be cured by, not cured, can be, okay, this is not by cured, but can help to control the ADHD. The first one is cognitive behavioral therapy. Second was behavioral therapy, educational intervention, social skill training, and also last one is psychotherapy. So alright, now I'm going to talk about the learning disability. So what is learning disability? This is a disorder in one or more of the basic cognitive and psychological process involved in understanding or using written or spoken language. May be manifested in age-related impairment in the ability to read, write, spell, speak, or perform mathematical calculations. So from the definition, they have mentions that people who had the learning disability, there will be impairment in reading, write, spell, speak, or performing mathematical calculation. So from that disability, there has some types or some categories that describe type by type disability. Okay, the first one was disorder of motor function. So what they will describe, what person will represent in disorder of motor function. The first one is include of motor skills and motor activity level. So the they will have motor skill dysfunction, which is a clumsiness, poor performance in gross or fine motor, dyspraxia, equilibrium deficits, or sensory motor problems. Also, they will present tics, grimaces, and choreoathetoid movements. Last one is they will have hyperactive or hypoactivity in their characteristics. Okay. The second one was educational disorder. So they will occur in one or more academic subject. They will affect one or more academic subject ataupun subject. So they will have a limited of or delay in copying from the blackboard, printing and cursive writing, organizing time and materials, understanding written and oral directions, reverse letters, cutting, coloring, drawing, and keeping place on the page. Alright, the third one is disorder of attention and concentration. They will have short attention spans and others attention deficit, restlessness, impulsivity, and motor and verbal preservations. Okay, the fourth one was disorder of thinking and memory. So they will have difficulty with abstract reasoning and concept formations, and by poor short and long-term memory capabilities. Okay, yang kelima, they will have problem with speech and communication, difficulty shifting topics of conversation, difficult with small talks, difficult with sequencing or words, sentences or sound, slurred words, and articulations problem. For yang keenam, auditory difficulties. So auditory perceptual and auditory memory problems, and not from hearing problems. So they will have difficulty to remember oral directions, sound outwards, block out background noise, and the sequencing of sounds, words or numbers. Okay, yang ketujuh, sensory integrative and perceptual disorder. They will have difficulty with laterality and directionality concepts and tasks that require visual perception skill. For the 8, they will have psychosocial problem. They will present as a temper tantrum or antisocial behavior, and child social competency may be delayed compared with their chronological age and mental age. So they will have sensitive and poor self-esteem and self-concept. Alright, for the last one, there are specific learning difficulties that accompany the learning disability. This is known as a reading disability. So a person who got they have disability with the writing, with the reading spells. So they will have one or more categories. Okay, from the categories.